Breast cancer is a diagnosis that no one wants to hear in regards to themselves or their loved ones. Did you know that 1 in 8 women will be diagnosed with invasive breast cancer at some point in their lifetime? Did you know that breast cancer is the second leading cause of cancer-related death for women in the U.S., second to lung cancer? Did you know that one clear, non-modifiable risk factor for breast cancer is the African American race? Factors that influence African American women's risk of breast cancer can include genetics, hormones, lifestyle, and socioeconomic status. So is there really a disparity? Death rates for breast cancer is 40% higher for black women. Mammograms decrease breast cancer mortality more so in white women than black women. African American women are more likely to get triple-negative breast cancer, an aggressive cancer that's difficult to treat and often reoccurs. Certain types of cancer have higher mortality rates for black women than white women, despite the stage or treatment timeline. Lastly, 5-year survival rate for Caucasian women is 92%. African American women, it is only 82%. So how do we prevent breast cancer? Annual exams. Studies have shown that women who routinely go to the doctor have routine mammograms. Avoidance of alcohol and smoking. This is especially important for African American women since studies have shown there's an increase in morbidity for them related to exposure from these substances. Health and exercise for weight control, and mammograms, which we'll talk more about in just a second, and clinical breast exams and breast awareness. Mammograms. Mammograms are so important. They're the gold standard for breast cancer detection. There's many guidelines. ACOG says begin them at 40 years old. The American Cancer Society says begin them at 45 years old. And the United States Preventative Services Task Force says 50. Regardless, mammography should begin by the age of 50 because there's an estimated of 80% of breast cancers that are diagnosed in women 50 years and older. Challenge we face is access to health care. Socioeconomic status is a very big factor here. This can contribute to decreased funds, affordability, decreased knowledge. We need to have routine follow-up appointments because that increases mammography. So look at the image on the right lower part of this slide. So in addition to the stressors of your employment, nutrition, your shelter, you also have to deal with your family. So a lot of these women are moms, sisters, aunts, grandmothers. They're putting the needs of their family first, and so we need to tell them that you are as equally as important.